Welcome to QuickMed Academy, where complex medicine becomes clear in just a few minutes.
Let's talk about the arterial blood gas, or ABG. Honestly, it's one of the most powerful diagnostic tools out there. It's like a direct window into the body's internal balancing act. And in this explainer, we're going to learn exactly how to decode it.
Okay, so for this, I want you to put on your detective hat. Think of every single ABG report you see as a new case file, a fresh mystery. And inside are all the clues that reveal exactly what's going on with a patient. And our job is to piece them all together and crack the case.
So what's this case file really telling us? Well, you can think of it as a snapshot in time. Just one single moment that shows us how the body is handling oxygen, carbon dioxide, and most importantly, its super delicate acid-base balance. This is the raw data, page 1 of our investigation.
And inside every one of these case files, you're going to find these 5 key clues. You've got your pH, PaCO₂, bicarbonate, PaO₂, and O2 saturation. Each one of these tells a different piece of the story, and figuring out how they all connect, well, that's the secret to cracking pretty much any case you'll see.
All right, so every good detective knows you start with the most important piece of evidence. And for us, that's the pH. This is always, and I mean always, where we begin. No exceptions. The pH is what tells us if a crime has even been committed in the first place. Is the blood too acidic? We call that acidosis. Or is it not acidic enough, which we call alkalosis? This is our first huge lead, the thing that tells us, hey, something is definitely wrong here.
But here's the catch. The pH is kind of like a fire alarm. It blares and lets us know there's a problem, but it doesn't point to the source of the fire. It confirms that an imbalance exists, for sure, but it doesn't tell us why. For that, we need to bring in our suspects.
So in this whole acid-base world, it really just boils down to 2 main suspects capable of causing this kind of trouble: the lungs and the kidneys. One of them is our culprit.
And this lays out their profiles perfectly. Our respiratory suspect, the lungs, they control carbon dioxide, the PaCO₂. They're the fast-acting suspect, right? They can change breathing patterns in just a few minutes. Then we have our metabolic suspect, the kidneys, controlling bicarbonate, HCO₃-. They're these slow and steady ones, taking hours, sometimes even days, to make adjustments.
Okay, let's start the interrogation with our first suspect's calling card, PaCO₂. Since CO2 creates carbonic acid in the blood, just think of it as the respiratory acid. So what happens if the lungs aren't breathing well? Well, CO2 builds up and boom, you get respiratory acidosis. And if they're breathing way too fast, they blow off too much CO2, causing respiratory alkalosis.
All right, now let's look at the metabolic suspect's signature move: bicarbonate, or HCO₃-. This is the body's main base, its buffer against acid. So if your bicarbonate is low, it means the body has either lost its buffer or maybe gained too much acid, leading to metabolic acidosis. And if it's high, that points you straight towards metabolic alkalosis. Okay, so let's recap. We've got our first big clue, that wacky pH, and we've profiled our 2 main suspects. Now it's time to connect the dots and figure out who our primary culprit really is. So this is really the million-dollar question, right? We know the pH is off. We just have to ask ourselves, was it the lungs and their control of CO2? Or was it the kidneys and their management of bicarbonate?
And this table, you guys, this is where the magic happens. It's so simple. You just match the pH problem with the value that logically explains it. Let's do one. Say the pH is low, so we know it's acidosis. Now you look at your suspects. Which one is also on the acidic side? Is the PaCO₂ high? Remember, CO2 is an acid. If it is high, you found your match, respiratory acidosis. But what if the PaCO₂ is normal and instead the bicarbonate is low? Well, losing a base also causes acidosis. In that case, your culprit is metabolic. The exact same logic works for alkalosis, just in the other direction.
And that's really the whole secret. This isn't about memorizing a bunch of crazy charts. It's just pattern recognition. You just ask, which of my suspects is moving in the same direction as the pH problem? That's your primary disturbance. Simple as that.
So we've nailed down the primary problem, we found our main culprit, but hold on. A good detective never stops there, right? We need the full story. And that means checking on oxygen levels and seeing if the body is trying to fight back.
This part of the file, this is all about the patient's immediate safety. How well is oxygen getting from the lungs into the blood?
PaO₂ and O2 saturation give us that answer. They're critical for spotting hypoxemia and telling us if the fundamental job of the lungs, gas exchange, is even working right. This is not some side plot. It's a vital piece of the clinical picture.
And here's where the plot thickens a little. The body never just sits back and lets things go wrong. See, the system that didn't cause the problem is going to jump in and try to fix it. This is called compensation. It's a physiological plot twist in our story. So if the lungs cause acidosis, the kidneys will start working to raise bicarbonate. If the kidneys are the problem, the lungs will adjust breathing to change CO2. It's the body's own internal backup system.
Okay, so now that we've looked at all the evidence, we've understood the motives of our suspects, let's wrap this all up into one simple, repeatable method you can use every single time.
Seriously, it all boils down to just 3 easy steps. 1. Look at the pH. Do you have acidosis or alkalosis? 2. Find the cause. Which of our 2 suspects, PaCO₂ or HCO₃- is causing that mess? And 3. Assess oxygenation. That's it. That's the entire framework.
You know, this quote just hits the nail on the head. The moment you stop trying to just memorize numbers and you start thinking about the actual physiological story, that dynamic dance between the lungs and the kidneys, it all just clicks. You're not just reading numbers off a page, you're actually seeing a living, breathing process in action. And that is why this skill is so incredibly important. Mastering the ABG is where the textbook physiology smacks right into the real world, right at the bedside. It's a fundamental skill that lets you take raw data and turn it into a powerful, real-time understanding of your patient's condition so you can make better decisions.
So there you have it. You have the method, the 3 simple steps to decode any ABG that comes your way. The body is always sending out signals, telling its story. And now, with this key, you're ready to start listening, to interpret those signals, and to unlock the vital secrets it's trying to share.